We are very, very happy and honored to have a very high delegation of conference. This conference is in partnership with the University of West of Scotland, where our Chancellor resides, and the CARID is partly a partner of MKU in this particular conference, and we are happy that we have been able to partner with the World Health Organization to come to this particular conference. There are a number of papers touching on a variety of economic issues that will be covered between these 2 days. So today is one of those days. It also gives a platform to our academics to be able to present their papers, and apart from that one, to be able to link with other international researchers for future collaborations. How will this impact learning institution? As you know, that learning institution has got 3 legs. It's teaching, research, and community engagement or community collaboration. And this particular research brings in the issue of knowledge sharing. We are sharing the knowledge not only in Kenya but internationally. And therefore it gives our academics a platform to be able to air out their findings. And some of these ones will be able to find their way into policies, will be able to find their way into improving the lives of the people. Because we don't want to do research for the sake of research. We want to be able to do research that is impactful. And therefore this will be able to benefit the community of Kenya and internationally, because the research is not, it might be local, but of international relevance.
There is a communication issue when it comes to communicating the nature of the task, the issue of health and migration, the levels of migration across the world. And it's not just in Africa, it's in Latin America, it's in Europe. We've had the Ukraine war and we still have it, and hundreds of thousands of Ukrainians left Ukraine to go to other Western European countries. So it's not just an African problem. It is not just an African problem, and therefore it has to be tackled at an international level. But the media sometimes takes a very narrow view of the problem, which doesn't help. In fact, it makes the problem worse, because if you demonize migrants from wherever they come from, then that just feeds a narrative that is divisive. And that's not healthy. It's not even good for your health to be divisive. And then the other aspect of this discussion that we had this morning is the way in which we can resource what is a real problem to receive migrants, to assist them in their jobs and in their integration into the local society in every country. And this needs resources. It needs money, it needs finance, and we shouldn't shy away from that, because otherwise we would just be talking about a subject for the sake of talking about it, and that's what we want to avoid. We want to discuss impact and action, and that's certainly a major part of what we're doing here in university over these 2 days.
The future of the world iko hapa. Na kwa hivyo tumesema kwa hii mkongomano ni kutafuta namna ambayo itapatia hawa watu wengi wetu masomo na pia suluhisho za shida ambazo wako nazo. Na hii pia ni opportunity ya watu kuangazia na kuuliza, je, Afrika itazidi kuwa nchi ama kontinenti ya shida mpaka lini? Kwa hivyo tunasema wakati huu ni wakati wa kujibu maswali ngumu, na hawa maswali tuna hope pia viongozi wetu watapata suluhisho ambazo zitafanya Afrika iwe kontinenti ya amani na kontinenti ya maendeleo. Kuna pia mjadala ambayo imeangaziwa sana kwa hii conference, na hii ni mjadala ya uhamiaji. Watu huhama kwa sababu refugees na migrants. Wale watu ambao wanatoka kwao kwa sababu ya shida, ya vita, na wengine ambao wanatoka kwenda kutafuta opportunities, greener pastures kutoka Afrika kwenda kwingine. Na tunasema serikali za Afrika wanafaa kutia juhudi kubwa sana ili watu wa Afrika waache kutoka Afrika kwenda nchi zingine kutafuta riziki. Walete mijadala ambayo itafaa kufanya Waafrika wabakie nyumbani, wa benefit, wajienjoy hapa Afrika, na wawe wakitoka Afrika ama kwenda pale pengine wanaenda kwa their own decision, not forced.
Fundings are never enough, unfortunately. I don't want to be superficial in replying, and they're not sufficient. Funding need to be accompanied by, as we mentioned today several times, political commitment to change the situation. We need to be supported by thoughtful policy frameworks, evidence, data, and capacity of the sector which is engaging. It's also true that certain countries which are hosting refugees and migrant population, they are not in economic conditions, or they are having some economic limitations. Well, in this case, the argument is very much important and brought up at the international level. We need to remind that those countries are renting a service for the global community. So the shared responsibility is a commitment of the international community, and when there are countries in economic difficulty, probably international resources, international support is needed. And we see a number of situations where this is happening. Well, this is it's a long public health discussion, not necessarily related to health and migration. First of all, there are, we know very well, new infective vectors that might also arise. This is a normal biology development of microbiology development, but then there are conditions of lack of essential protection where communicable disease might appear. Let's see the case of tuberculosis. It's intimately related to poverty, to deprivation of acceptable living conditions, that even if we have a cure, even if you have very effective drugs, the situation remaining a matter of concern, also because it's relevant in a particular group of the society. There are other communicable diseases, particularly where technology innovation show great progresses. Now the vaccine for malaria is tested and rolled out, and the response is very high. We're talking about, usually there is a very limited reference to the morbidity and mortality that malaria does around the world. So this is a major innovation step forward. The situation is a little bit more complicated when we go to what we call chronic diseases, because there depends very much from our personal choice of life. If I like to drink, I might expect that this will have some consequence, impact in my health. And what is important, what the health sector need to do, need to invest into health promotion, explaining to population what is the health rate inside wrong type of nutrition, type of food, or exposure to what we call risk factors like smoking and alcohols, or unhealthy behaviors, lack of physical exercise, and etc. This is unfortunately the element of chronic disease is a matter of big concern, because we see that there is not really a geographic boundary. We cannot say anymore that those are diseases related to well-being. So for each countries, this is related to individual behavior, and they are extremely important even in countries which are now improving their own economic status. So we see, for example, in Africa, a very concerning rate of mortality and morbidity for cardiovascular disease, hypertension, untreated diabetes, and so on.
So we actually focus on 97% of grants on research and delegations projects at KTP, Africa, without discrimination, without differentiation, at the country level. Next one, please. Bringing to the issue, also helping us to advance the, we put a lot of efforts in this as well, training before, to detect together with the Ministry of Health what function and what not, and then based on that to design a plan of technical assistance. And many of them many of them really want to do carry or be associated. 30 seconds of focus since the audience is mostly by example. So our consultative process, we call this call for action. So we have clarity of the direction that we should be intersecting with all goals of SDG, but particularly there are some of them which are in academic institutions because we want to even or somehow fill the gap of absence. And we have called Kenya University who for the first time brought up the issue of migration in a very strong manner.
Mr. Joe, Dean School of Business and Economics, to do
put in place. Next one, please. To conclude the process with the first. Next one, please. I was obtaining ammunition into my reservoir for pretty straightforward how the link to translate this global high. If I decide to have a
informative background.
we say, okay, what is the time you want to give to us to produce results?
My attendee, I think, is online. He's the regional lecturer by Dr. Severini. It's very, very difficult.
It will be moved with the participation of all components in order to move.
Potrebbe succedere.